All right, so going next to the second to the last type of catheter I will be discussing. This catheter is known as the Foley catheter, right? So you can see the Foley catheter is just simple, right? Just insert it right into the urethra. You inflate the balloon, help to put it in place. Then you start draining the urine and all those stuff, okay? So we ain't going to waste time on the Foley catheter. We'll be discussing it straightforward from the definition to the types, to the insertion technique, to the care of the patient, to the complications that could result, and basically how to remove this. Okay, so moving. I'm coming. Talking about the definition right now, I would say that the Foley catheter is a type of urinary catheter that is inserted into the bladder. And why are you doing this? To drain urine. Okay, so it is a commonly used medical settings to manage urinary incontinence. If you are not able to basically what pass out urine, they could just put this catheter direct into your bladder and help to drain out to urine. Okay. It also what it can help to relieve urinary retention or monitor urine output. Now, what are the different types of Foley catheters that we have? We have the latex catheters, we have the silicone ones, basically looking at the materials. We have the hydrophilic catheters, we have the silver coated catheters. This one are coated with antimicrobials. Okay, then looking at the insertion, what is the method of insertion? The catheter is inserted through the urethra into the bladder. Now a balloon is inflated to secure the catheter in place. All right, you don't, can you see this balloon right here? You don't inflate before putting. After you put, okay, then you inflate. This is the balloon inflation port. You inflate and deflate there. If you want to remove it, you now deflate. Okay. So what is a care? Proper care is essential to prevent infections and ensure that the catheter functions correctly. And the different types of cares include you could clean the catheter and the surrounding areas to prevent all those infections. You could empty the drainage bag regularly. Okay. You could monitor for signs of infections. As you are using this, you are monitoring it simultaneously. What are the complications that could result from use of this catheter? It could lead to infections if not monitored properly. It could lead to catheter-associated infections. It could lead to blockage or obstruction. It could lead to irritation or discomfort. All right. You could say there's a balloon port for inflating this balloon. Okay. So talking about the removal right now, we say that the catheter is typically removed when it is no longer needed. And of course, you inflated the balloon to keep it in place. If you want to remove it, you basically what? If you want to remove it, you basically deflate the balloon to take it out of place. All right. That's just simple about the Foley type of catheter. Basically talking about types, insertion methods, removal methods, care, and complications. That's it, guys. Bye for now.